Brock, and I'm the Operations Director for the Global Resource for Advancing Cancer Education, and I'm talking with Mike Herman. And Mike, would you like to introduce yourself?
Yeah, good afternoon. My name is Mike Herman. I am now a 12-year survivor of an incurable cancer, multiple myeloma, diagnosis that came with a mere 4-year life expectancy. So I'm really happy to be here chatting with you today.
That's great. Thank you for being here. Let's talk a little bit about your cancer journey. Can you take us back to when you first received your diagnosis?
So this is kind of they talk about the good, the bad, the ugly. This was the really ugly. So I was with an HMO. My GP there had sent me for blood work probably 4 times in 5 weeks. So we knew something was happening. I knew something was up. I knew my wife knew more than I did because I gave them permission to chat with her directly. And I after all of this, I get an email saying, "Look at your patient portal. There's a message." I am ecstatic, right? One thing I know for certain without any hesitation is there's no way that they would notify me that I had cancer through a portal. So I open the letter up and I start reading it, and I remember you have multiple myeloma. And I remember that split second before the next word thinking, I don't know what multiple myeloma is, but thank God it's not cancer. And you know how it stinks to be wrong sometimes. So, but I still wasn't sure, right? I'm still like, they wouldn't, no one would do this to anybody. So I read it and read it probably half a dozen times. And then I called my wife because I knew she was going to say, without a doubt, no, no, you misread this, or this is what this means, or something like that. She hesitated a second, and that that's when I knew I had cancer. Um, so it really was not a very good experience, not a very good way to kind of go into your cancer career, as I call it.
Yeah, yeah. What year was that?
That was June 4th, 2013.
Okay, okay. And so at that time, what were your next steps?
So we were talking with this HMO, and they were big out west. I was working for a company outside of DC, so they had no hospitals out east. And we had asked that we got on a phone call with them, and my wife says, "Okay, can we get a list of the doctors? I'd like to look through them, see what their credentials are, and this and that." And they said, "Your doctor is Doctor." And she's like, "Oh, is she a multiple myeloma specialist?" And they're like, "No, she's an oncologist." But does she specialize? She specializes in all blood cancers. So my wife says, "Okay, how many multiple myeloma cases does she do a year?" We don't know. And my wife says, "Well, what if we weren't a specialist?" And not exactly, but very close to exactly, their answer was, well, you have three options. Number one, you could just come here and we promise you the treatments are as good as anywhere. Number two, you could move out west where we have hospitals and you have more choice of doctors. Or number three, you could go, literally what they said. Number three, you could go anywhere you want, but we're not going to pay for any of it.
Hmm.
So again, a very, very difficult way to really start this whole thing. A feeling of mechanical, everything they did, and also, quite honestly, a feeling of we don't really care, right? This is how we do things, and you know, we don't even, almost an attitude of we didn't even know why we're talking to you because we don't care. Obviously, they didn't
Hmm.
say those words, but it was. It was then when my wife and I, just said, well, we have no choice right now, right? We don't have millions of dollars to go to our own doctor, but So we decided to go see this doctor, who had my cancer treatment planned out literally for the next 2 years, right? Didn't Not what's going to happen next or if this happens or whatever, but here's what's going to happen. You're going to start on RVD, Revlimid, Velcade, dexamethasone, and you're going to be on that for, I don't remember the time, but this long, and then you're going to go for a bone marrow biopsy, and then we're going to put you back on this, and that's how the treatment goes. Uh,
Right.
so again, it was from ugly to super ugly, if you will.
Hmm.
And fortunately, it things changed significantly shortly down the road from there.
Yeah. And so those are the boundaries because you're in an HMO. That was a lot of the boundaries there. And that's something that people don't talk about a lot. And
They
that's
don't, and it's so critical because you have no choice, and you're also made to feel like not only no choice, but you just there's no say in what we're doing, right? So they
Mhm.
never said, "Hey, here's what we're doing. We're gonna start you on a dose of this, and these are some side effects or anything." It was just RVD. That's what you're getting.
Right.
But if I could step back a second, one thing I forgot is when we went to see her, and thank God for my wife. First thing she says is, "You have a B12 deficiency. It's not cancer."
Hmm.
And my wife, who is all of 5'2" and 120 pounds at best, all of a sudden she's like, "No," and she's like not used to being talked to that way, and she's like, "Well, what do you mean no?" And she's like, "People don't bend over and break bones from a B12 deficiency." And she's like, "What I'd like you to do is go home and take supplements and come see me in 6 months."
Hmm.
And my wife said, "Nope, we're not doing it." She says, "Well, you have no choice." And she says, "We're not going anywhere until we get a better answer than this." So finally, because we were such pain in the necks, she finally said, "Fine, go downstairs and get a bone marrow survey," which is nothing more than X-rays head to toe. I don't know if it's 20 or 30, whatever.
Hmm.
And that's what what led to the follow-up email a week or so later, telling me I had cancer.